away from your time. So I'd like to start off. Good morning, everyone. Good morning, and welcome to the Safeway Pharmacy MS Connections Conference. I'm Carol Frederick, Director of Client Services, and I'm going to be both your MC for the morning, do introductions, and then wrap up. A few housekeeping matters. One is the washrooms are just outside this room. Are they not? Just outside this room? Yes. So when you go out, I think to the left. And we also have a healthcare aide with us today, so if she could stand up right there. So if you need any assistance, she will be available. Dorothy, is that you? Yeah. Dorothy. And lastly, a reminder that you have an evaluation form in your conference bags. And so please, it's really important for us to get your feedback so that we can do things better and different next time. So if you would fill it out at the end of the day and turn it in at the registration table when you leave. Okay? So hopefully you're all in the right room. So this is the session, Women's Health and MS. So I'd like to welcome Sharon Peters and Janice Lake. Sharon is a clinic nurse, which many of you may be familiar with, at the Calgary MS Clinic, and has been involved in multidisciplinary care of MS patients since 1994. Her interests in the MS Clinic involve managing the chemotherapy program as well as patient education. She is also very involved in regular day-to-day clinic activities. She's a member of the International Organization of Multiple Sclerosis Nurses and received her MS certification in 2003. In 2007, Sharon received the Professional Care Award from the MS Society Alberta Division for her work with persons with MS. Janice is a rehabilitation nurse at the OPTIMUS program and has been involved in multidisciplinary care of MS patients for 15 years. Her interests in the MS clinic involve symptom management specific to bladder, bowel, and sexual dysfunction and patient education. So I'd like to welcome Sharon and Janice.
Thank you so much, Carol, for that kind introduction, and thanks to everyone on the MS Society team for having us here today. Can everyone hear me okay? Yeah. So Janice and I were excited to talk about this topic. It's a topic that doesn't get covered very often in a lot of MS conferences, so we were excited to kind of tell you what we know about the topic. And so we'll get started on women's health issues. Does everybody have a copy of our slides? Because if you don't, there is more up here available. And questions, if you have questions, we try and maybe save them to the end. We'll try and allow time at the end for questions. But if you have a burning question that just can't wait, by all means, raise your hand and we can deal with it then, okay? So just to get everybody in a mood, because we know mood's important for women, we'll talk a couple slides just showing the differences between men and women and how they think. So I'm not a cat person myself, more of a dog person, but you could substitute that for whatever you'd like. And this one I really like, where it shows the differences between men and women when they shop. Where the red line is where the woman would go and how much she would spend, about 800 bucks. And if you're like my husband, you go directly there and spend about 30 bucks. So what Janice and I are going to try and talk to over the next hour, we'll talk a little bit about gender differences and just what's available there. Wellness, we're going to talk about having your period and what happens with that. We're going to talk quite a bit about sex and relationships. Great morning for Saturday morning topic. We'll talk about pregnancy and reproductive issues, a little bit on motherhood, some on menopause, and a little bit on osteoporosis. So we'll try and cover little bits of a lot of different topics that affect different women. The one thing I would like to say, in terms of research, because I know at the clinic we like to tell things based on what research has been done. And in all of these topics, there's not a lot of research. But we will, as we go through, point out where there is little studies suggesting something, but it's more just opinions that people have on different topics. And just very briefly to remind everybody about MS and how popular it is in Canada. And primarily that it's mostly affects women. About 70% of people who get MS are women. And you have to think too about the age that affects. So usually it's between the ages of 20 and 45, although certainly we diagnose at every age of the spectrum, from very young, teens and even younger, to people in their 70s and 80s we can diagnose. But primarily between 20 and 45, and those are such important years for women, where you're trying to make lifestyle decisions and career decisions and decisions about having a family and children and all that type of thing. So a lot going on in those years for sure. And just to remind everybody else, I'm sure everybody in this room knows that there are different types of MS. So some of what we say today will depend on which type of MS that you do have. And also the fact that to date there is no cure for MS, and it is a progressive disease. So again, things will vary depending on where you are at in terms of the disease process. So in terms of gender differences, we do know that relapsing remitting MS, which is the most common type of MS, about 85% of people when they are diagnosed with MS will have relapsing remitting MS. It's definitely more common in women. Whereas progressive type MS, it's more even between the sexes. So there's a little bit difference right there. We know women tend to be diagnosed earlier than men. We're not sure, is that a genetic difference, or do women are we more in tune to our bodies and maybe report symptoms more? We don't know what the right answer is there, but definitely women are diagnosed earlier. The good news is that women tend to have a better prognosis than men. So men tend to have a bit more progressive disease, and women tend to fall into that relapsing remitting category and do tend to have a better prognosis. There's a lot of speculation about MRI changes. Are there differences between the sexes? There's some studies suggesting there may be, but really more research is needed, so we don't know that for sure. So that's something that they're still looking at on an ongoing basis in terms of research. Certainly women seem to be affected more by certain symptoms. Definitely women have more neuropathic pain than men tend to do. When you have MS, bladder symptoms seem to be more common in women as well. Again, women tend to have children, so that leads to bladder difficulties as well. So it may be related to that, we don't know, but definitely report it more. And women tend to report more depression and mood changes. And again, women like to talk more. So do men experience that and just don't report it? We don't know, and that's really unclear, but certainly women report depression and mood changes more in MS. Symptoms that you have when you have MS can be treated differently too, depending on the gender. Certainly sexual dysfunction, pretty easy to treat in men and most men. With women, it's way more complex. We're complex human beings, so it definitely takes more to treat it in women. And also looking at differences in response to disease-modifying therapies that are out there for relapsing remitting type MS. Are there differences in the sexes? Certainly in all the research trials, they look at those types of things. And that's ongoing. I think we don't know that for sure if there are differences, but certainly that's still looked at. Optimizing wellness, we harp on that all the time at the clinic, and probably everybody in here knows most of these wellness strategies that we often recommend, so I'm not going to go through them all here today. You have them in front of you, and certainly you can contact Janice or I if you have questions about those. I will point out certain things like smoking. There are a lot of research trials to show that smoking can increase relapse rate and increase rate of progression in MS. So we do definitely strongly discourage smoking for sure. And it's really important, the routine screening for medical exams, to have that visit with your family doc once a year, get those yearly pap tests and that type of thing are really important, and we stress that as well. Recognition and treatment of depression and managing stress is huge for everybody, even whether you have MS or not. And we're going to go through in a little bit some tips on coping that we have. Vitamin D, 4,000 international units a day is what we recommend. Probably everybody in here, I'm sure, this isn't new news, so I'm sure everybody here is probably taking vitamin D. We do think it has a very stabilizing effect on the immune system. And it's certainly low vitamin D levels are being linked to a lot of other medical conditions right now, not just autoimmune disease, so we do think it's important. And the annual flu vaccine, it is the fall coming up, so we always get lots of calls to the clinic in the fall asking about that, and we definitely recommend an annual flu vaccine.
So some tips for coping. Can everyone hear me okay? Or? Yeah. Okay. The important one is to be in charge of one's own health. That's really important.
Sorry, can you speak up?
Oh, sorry. Okay. Is that better? No?
Yeah.
So an important tip to start is to be in charge of your own health. Establish a good rapport with your family doctor. Utilize the services of the MS clinic, the MS neurologists, and the MS nurses. Utilize the services of our OPTIMUS program, and then explore various resources that the MS Society have to offer. With this next point, be realistic and flexible about your MS. I know that's easier said than done, and for some people it takes a bit of time to work through the process. It might be different depending if you're newly diagnosed or if you've had MS for many years. I think though, if you maybe try and challenge yourself for different thinking or different strategies and seeing if you can adapt to different situations, you might find that that could be helpful. So for instance, if someone is quite advanced using a cane for walking, they might find that if they would just give it a try, it could open the doors to being more mobile and doing activities with their family, or for a woman who might need to use a catheter to drain her bladder if there's retention, that again could open doors to being more active in their life and not becoming so isolated. Maintaining strong bonds. I think this is important for any one of us. It's important to spend time with our family and friends, the people who love us and who we love, to reach out in those times of need. I think when we go through difficult situations, sometimes we tend to isolate or withdraw to ourselves, but I think that's a real important time that we need to reach out to talk to that person who has that ear for us. They might not be able to solve our problems or answer all of our questions, but I think it's really important just to have that communication. Setting goals, I think that keeps us all on track, whether we have MS or not. It's important to prioritize our tasks. It keeps us kind of motivated. We see what we need to do, and you can kind of break that down into tasks by seasonal tasks. For instance, the spring, you want to paint the fence and plant that lilac bush. So 2 important tasks you want to achieve. You can do it by monthly tasks as well, or goals. The month of October is coming up. What are 3 important things you want to accomplish? And then by week and day. So Monday, my important goal is I have to pay my Shaw bill online. You know, those types of things. And it kind of keeps us on track. And then again, being aware that you might have to reprioritize that or move them to another day, which is fine. Find an exercise program that is right for you. That's really important because we do know that exercise is very important for our physical well-being as long as our mental well-being. And just remembering that a little bit is better than nothing. Tips for coping also include kind of relaxation, strategies to kind of find our inner peace, enjoy the calm, whether that's meditation, deep breathing, which I need to do right now, and just kind of being aware that you can relax. So, and that whether that's, you know, going for a walk or enjoying the outdoors or having a bubble bath or enjoying your cup of tea, that type of thing. And research, and I think all of us know that our own spiritual values and beliefs play a very important role in how we cope with difficult situations. Adding fun and humor to our life, that's huge. I think as women here, we can relate to those times, whether we were with friends or family, where you know, we laughed so hard, the situation was just hilarious, that we were crying, you know, or mascara was running down our face, or we laughed so hard we peed our pants, and we think, oh, that was so worth it, that was okay. So this next slide, just to bring some humor, this little girl says to her mom, "Mom, what is normal?" And she says, "It's just a setting on the dryer." And then the cute one, Calvin and Hobbes. So, okay, so Hobbes says, "What is that cereal you're eating?" And Calvin says, "It's my new favorite chocolate frosted sugar bombs." "Have a taste." "Thank you." And of course, he's freaking out, and Calvin says, actually, they're kind of bland till you scoop sugar on them. So I think that kind of highlights. We all have different tastes and different situations. So mental health help. We're truly very fortunate in Calgary to have a lot of excellent resources available for mental health. We have a few psychiatrists that work along with our MS patients. They work out of the Peter Lougheed Center, Dr. Vanjie and Dr. Patton. We have a neuropsychiatrist that works out of the MS clinic half a day a week, Dr. Mackey. We offer a CBT group, Cognitive Behavioral Therapy group, which is run out of the Foothills Medical Center. It's a 10-week session, and it's a group setting where they give you strategies to focus on coping with anxiety and depression by changing one's way of thinking, behavior, and dealing with your emotional responses. This book, Feeling Good by Dr. David Burns, is an excellent resource, and a lot of our psychiatrists recommend this. Again, it also gives you strategies to help lift one's spirit and develop a positive outlook on life. This last resource, the Mobile Response Team, it is for any Calgarian, whether you have MS or not, so it's open to the whole public. And it is a multidisciplinary team run out of Alberta Health Services, and it offers outreach, crisis, prevention, intervention in acute situations where there is imminent danger to oneself or others. So, that person is going to harm themselves or their family member. And it's a phone number that you can call, and during certain situations, they will come to your home to diffuse that situation. And just remembering that you can call 911 in case of an emergency, and that can be a mental health crisis as well, or going to your nearest hospital to the emergency department.
So one of the most common questions that we actually get at the MS clinic as nurses, we get a lot of phone calls about patients calling in reporting symptom fluctuation and changes in their symptoms. And what we find, and this is kind of, and people are always kind of surprised to hear about this, but we really do believe that women's, when you're having your period, definitely women will experience more symptom fluctuation. And there's actually a couple of small studies that actually supported that. And what they find is about 7 days before your period, about 3 to 4 days into your period, it's very common for women who have MS to have more fluctuations during that kind of go along with those other premenstrual type symptoms and stuff that you might have. So don't be surprised if that happens. Certainly it's very common. They actually wonder, one speculation is whether it could be related to changes in body temperature. A woman's normal body temperature increases when you're having your period. And so they're wondering, could it be related to that? Kind of like the way some people are sensitive to heat and that causes more fluctuations and stuff as well. Certainly, there's a lot of medications that we use in MS that also affect a woman's period. Things like antidepressants, chemotherapy drugs, some of the interferons that are used, and Tysabri, one of the other disease-modifying therapies. Sometimes they can cause things like breakthrough bleeding or spotting, things like that, and that can happen. Most women aren't affected by it, but certainly it could happen. And if you have changes like that, please feel free to talk to your doctor or nurse about that. And the other thing to consider too is that depending on the symptoms that you have with MS, if you have some tremor or some coordination problems in your arm or a little bit of weakness in an arm, it can actually become very difficult to manage your period in terms of using tampons or using pads. Those types of things can become difficult depending on the types of symptoms and stuff that you have. So that's important to know that as well, and know that you're not alone in that, and talk to your doctor about those things to see if there's anything that they can do to help you with that. Sometimes they can offer you medication or things, that type of thing, to slow down your period so it's not such an issue with you. Another question that we actually get asked a lot, particularly when people are newly diagnosed, is whether it affects fertility. And we want to stress it does not affect fertility. So definitely you still need to use birth control for sure. There's been a little bit of research looking at using birth control in MS in terms of does it make any changes to the disease or anything. And no, there was no change in relapse rate or anything like that. When people use birth control, it doesn't cause any harm, doesn't seem to affect MS at all by using it. Certainly the symptoms that, again, that you have can affect your choice of birth control. So in terms of using condoms or IUDs, if you have a lot of bladder infections, for instance, as part of your MS, IUDs sometimes can increase the incidence of bladder infections. So that would be something that you'd want to consider when choosing your type of birth control. Things like condoms, probably everybody here knows that when you have an underlying infection, like a cold or flu or a sexually transmitted infection, it stirs up your immune system and your immune response. So it's important to use protection if you are sexually active to try and decrease the incidence of sexually transmitted infections. Also, in terms of birth control, other drugs that we use sometimes in MS, and the other thing to consider too is complementary therapies as well. Sometimes can interfere with the effectiveness of the birth control medications. So just be wary of that. Talk to your doctor or your pharmacist about that for sure. And the other thing to consider too is that if you do have limited mobility or if you are a smoker, that can increase your chance of having blood clots in your legs, which when you're on the birth control, that's kind of two things working for that particular symptom. So that's something to consider as well.
Okay, so now that we have the contraception all figured out, now we're going to talk about sex and intimacy. So this topic definitely could be an hour-long topic on its own. So I'm just going to highlight some important points and go over some strategies. So it's really important to remember that sexual problems are very common in the general population, whether you have MS or not. So each one of us, through our stages of our life, whether it's adolescent, young adulthood, middle age, or into the older years, are going to have situations, things beyond our control, whether it's health issues, whether it's emotional issues that will impact our intimacy and sexual response. With MS, we know that it can affect the specific nerves that control the whole sexual response cycle. We also know that there's certain symptoms of MS that can impact that as well. And then again, just general factors that will play a part. So let's take a closer look. So in respect with MS, we tend to group sexual problems or symptoms into three different categories, with the first one being primary sexual symptoms. So these are symptoms that occur as a direct result from the impact of MS on our central nervous system. So some symptoms may include altered genital sensation. So that can range from absolutely no feeling to a patchy numbness type feeling to a tingly feeling, all the way up to a heightened painful feeling. So strategies used to help in this situation kind of focus on kind of trying to break through that cycle of numbness or a decreased sensation that your body isn't picking up certain feelings. So again, what you feel comfortable with and discussing with your partner, using different strategies to increase that arousal in the excitement period of the sexual response cycle. So that could be the use of vibrators. So there's many different types and kinds on the market, small to large, and they have different intensity of the sensation that they will be giving, and that can make a big difference. There's a strategy called body mapping, and it's a new approach to sensual and arousal ways of looking at different touch to your body. So again, doing that yourself or along with your partner, you would be in a comfortable position, you're naked, and you're starting from your head, working down to your toe, where you're just applying different types of touch, and you are becoming aware of those feelings. So that could be a light feathery touch, that could be more of a circular motion, a deep pressure touch, and you're touching various parts of your body. And it's amazing how when one area decreases in sensation, other areas can pick up that arousal type of feeling, whether it's your earlobes or your toe or your inner thigh, whatever it is. If the feelings are more a painful, unpleasant sensation, then discussing with your family doctor or your neurologist, because there are certain medications out there that can help with that painful sensation. Vaginal dryness. This can be very common for women, and we know MS itself, because of the nerves and the impact on the whole process of lubrication and the sexual response cycle, it can definitely be effective. So there's a wide range of various lubricants out on the market, and they are water-soluble lubricants such as KY Gel, Replens, Astroglide, and nowadays you could kind of be in that section for hours because there's like different colors, glow in the dark, different tastes, different sensations, whether it's a tingly or a warmth feeling. So really you have a wide range to choose from. You might, again, in communication with your partner, want to discuss different options of foreplay. So what once used to work might not work now. And you might need to try things for a little bit longer or kind of mix things up and use different techniques. Focusing on getting your mind in the mood is really important because we need to be in the moment. And I know as women, kind of like that slide that Sharon showed, we're like all over the place. Oh, I gotta make lunch, I gotta do this, I gotta do that. And sometimes it's just hard to kind of focus. But that might be, again, with different types of foreplay, doing different things than you once used to do. So I know there's a wide range of movies, videos, magazines, and books out there that kind of perk up your erotic sense. There is that erotic novel out now, that trilogy, 50 Shades of Grey, that's very popular, and oh yeah, it gets your imagination going, that's all I'll say. So, you know, just kind of looking at things differently and trying different strategies. Decreasing tone to the vagina. So again, that's a direct impact on the nerves. So an important way to help with that by strengthening your pelvic floor muscles, which in turn will increase the strength of your vagina, is using the Kegel exercises, or trying to find a physiotherapist who specializes in the strengthening of the pelvic floor. They use biofeedback strategies, vaginal cones, vaginal weighted balls. They're little metal balls that you insert up into the vagina, and you use your muscle to hold them in. Another factor that can impact the strength of your pelvic floor muscle and your vagina is the fact that if you are in menopause, the lack of estrogen plays a big role in the strength of that muscle. So discussing that with your family doctor for possibly use of estrogen topical cream or hormonal replacement therapy could be beneficial. But again, it's very individual because there's different kind of thoughts on hormone replacement therapy now. The loss of libido. So remember that sensual and sexual pleasure can be achieved without desire. And sometimes if this is an important goal that you want to achieve as, being yourself or involved in your relationship, you just have to start the process and just kind of give it a try and get that whole ball rolling. Again, getting your mind in the mood, whether that's your environment, different types of music, lowering the lights, candles, a bath, a massage, those types of things, just to try new strategies. Trouble achieving an orgasm. So that can be related to a type of performance anxiety if you find that that's kind of your focus and you're worried about it and you're just like, I gotta achieve it, this has to happen, then chances are it's not going to happen just because you are so focused on that. So again, trying to relax, communicating with your partner, looking at different, maybe thoughts to this whole intimate cycle that you want to achieve, whether maybe that isn't the priority, that isn't the goal, and then just kind of using different strategies. Again, back to strengthening our pelvic floor muscles. If the muscle of our vagina is strong and we have control over it, it makes a big difference to our ability to achieve an orgasm. So the second category is called secondary symptoms. And so those are MS-related physical changes or MS medications that can indirectly affect the sexual response. So, fatigue. We know that MS, definitely people experience MS fatigue. So again, looking at strategies to help with that. That might be the use of certain medications to help with fatigue. Looking at things a little differently, where maybe time to be intimate might be in the morning instead of night. Or looking at kind of pre-planning and saying, okay, this Saturday I'm going to have a nap, and then when I wake up, that's when, you know, we might become intimate so that you have some rest. Again, fatigue as women, you know, we have many things we're doing, whether we're a mom, we're a wife, or we have a job. So again, it's trying to set that goal as to what's important and what we want to work on. Sensory changes, so spasticity, pain, and tremors. Again, maybe utilizing certain medications, muscle relaxants, pain medications, trying different positions, using pillows or different adaptive aids might be helpful. The use of massage in foreplay. So if you have a tight hip flexor or a tight foot or an arm that's not doing very well, maybe incorporating some massage to help loosen up those areas. Bladder and bowel, we know that definitely you need to use a bit of pre-planning in those areas. So that might be, for instance, for the bladder, the use of certain bladder medications, or restricting or limiting your fluids a few hours before you know you want to become intimate. Caffeine prior to sexual intercourse is very helpful because that will drain your bladder. And you know then that you'll have less chance of accidents and less leakage during sex. Changing positioning as well, that will help decrease pressure on the bladder. Doing the Kegel exercises, because as we strengthen our pelvic floor muscle, that will help our urethra, which is the tube that the urine comes out of from our bladder, and that will make it nice and tight there so that there should be less chance of urine leakage. Communicating to your partner your fears and concerns, I think that's truly very important. If you're just open and honest and say, hey, you know, I'm really worried that I might leak a bit of urine during our intimate time here. I think just getting that off your mind, number one, is a huge relief. And I also think that in most instances, your partner won't be too concerned about that, or it won't be as big as a deal as you think it is. Bowel, again, a lot of pre-planning with that, and that's just about establishing an effective bowel routine that might take time and take a lot of work as well. Cognitive impairment, so we know that that can also be challenging depending on the impact, but again, getting your mind in the mood and trying to focus on what you're wanting to accomplish. So again, a quiet room, maybe the door locked, certain time of day, whether that's meditating before, kind of getting your thought process going and working on those strategies. Side effects of medication. So we know MS, a lot of the medications used do have side effects that interfere with our sexual response. And that can be decreased desire, decreased libido, or decreased ability to have an orgasm. So discussing with your doctor various options regarding that. So the third category, emotional or tertiary responses, are problems related to physiological, interpersonal, or social issues that interfere with your sexual feelings or responses. So I think of those problems as kind of your mind, what's going on inside your thought process. That can be really complex and will vary from individual, but it could be anything from not feeling very good about your body, maybe you've gained 20 pounds or so because of a side effect of a medication, to really grieving the loss of the body that you once had, dealing with changes and dealing with emotions, maybe not feeling quite as attractive as you once did, thinking like, who would want to be intimate with me now? And then feelings of depression, feelings of worthlessness, those types of things. Also worrying about your partner in many ways, like what's my partner thinking, what's happening, like what's going on in my partner's mind. Also, there's changes to roles sometimes within a couple. So your partner might become your caregiver, which then definitely impacts the whole intimate role. So when you think of treatments, I mean, I went over some strategies really quickly, and then with this last category, huge is communication. You need to be open and honest with your partner about your feelings, setting an appropriate time where you can just lay it out on the line, just discuss your feelings and your concerns. And I think at that time it's really important also to establish a goal, or to establish what's really important to the both of you, and they might be different. So for instance, as a couple, the goal of having an orgasm every time you're intimate might not be a goal. That might not be what you want to achieve, and it might be more about cuddling or just being close, having a time where you can really communicate, some touching, but really the ultimate goal is so individual. Again, there's many outside agencies that can be helpful for individual counseling or couple counseling. You can discuss these issues with your family doctor, with the MS nurses, with the neurologist, with myself in the OPTIMUS program. We have a psychologist, Nicole, who also specializes in therapy for couples and for individuals. If you're seeing a urologist or a gynecologist, sometimes that's helpful also to discuss. I think also it's important to know that when you reach out to that professional, just to be aware that as individuals, we all have our own thoughts, values, our own comfort level with sexuality. And it might not be the same as yours. And so it might not, you might not find that person right away that you can feel open and honest with, just because, again, there might be that conflict. So keep looking, don't be discouraged, because there is someone out there that can be helpful. And I just want to leave you with this quick little quote that I found from this great pamphlet, MS in Your Sex Life, and we do have those on our table out in the exhibit booth, by Teva. And it says, "Discard any notions that great sex can only be achieved by two perfect people with perfect bodies. Anyone, young and old, able and disabled, can enjoy a satisfying sex life. Great sex is however you and your partner define it."
The other thing I wanted to mention too is that I realize the topics we're talking about today sometimes are personal, so you may have questions that you don't want to ask about in a group situation. So by all means, please email or call Janice or I. Our email address is just our name, so janice.lake or sharon.peters at albertahealthservices.ca. So don't hesitate to contact us too with any questions that are personal and you don't want to maybe share today. So now you've been having a lot of great sex, and maybe whether you're using birth control or not, everybody knows the consequences of sex without birth control. So we're going to talk a little bit about deciding to have a baby and getting pregnant. So the big thing is that parenthood is challenging for everyone. Whether you have a chronic disease or not, it's certainly a decision that every couple needs to put some thought into before you go there. There's lots of things to consider, and really one of the big things that we want to get across is to think more. When you think about having a baby, usually people think about having a baby. They don't think about having a really busy toddler that's going to be running all over the house, getting into trouble. They don't think where Janice and I are at right now with teenage daughters. We both happen to have two girls, and that talk back to you and how you're going to respond to that. So there's when you have a baby, you have that baby for life. So that's important to remember. Sometimes when you're young and deciding about that, you kind of forget that part of it. Certainly, again, open communication with your partner. We've been harping on that the whole time with these types of topics, and certainly that's important too. And thinking about your resources, your emotional resources, your financial resources, where you are at in your disease, and thinking about the future, thinking about future disease-related changes. And if you have a baby, how are you going to manage that? Sometimes it's really hard to predict that, but at least having that conversation and just being open with your partner that you're concerned about that is important to think of those things. Having support in place for if you're going to have a baby in terms of after the baby's born, in terms of getting sleep and getting back into your wellness strategies and exercise and all those types of things. How are you going to manage all that? And having those support systems in place is really vital. Talking to your doctor and nurse, certainly about any medications you're taking. I put one website up here called motherrisk.org, which is a website out of the Toronto Sick Kids Hospital. And it's a wonderful website for women who are pregnant or breastfeeding or thinking of becoming pregnant. Because certainly you can call that website or you can access it online as well and let them know what medication you're on. Would this be harmful to the baby? Is this okay to take in pregnancy? It's very useful, and we use it a lot at our clinic and hand it out to a lot of people as well. And seeing your family doc, reviewing all the medications you're on, and if you're thinking about becoming pregnant. And are they okay to take if you're becoming pregnant, or do you need to come off them? And if you need to come off them, you know, do you need to wean off slowly, or can you stop right away? Those are all important things to know beforehand. And also talking to your family doc about prenatal vitamins and what vitamins you need to be taking prior to trying to get pregnant. A lot of our patients, particularly who have relapsing remitting MS, are on a disease-modifying therapy. That's what DMT stands for. And so knowing none of these medications are recommended when you're trying to get pregnant or pregnant. So knowing about that and having a plan for stopping your medication for pregnancy and going back on in the postpartum period. The Food and Drug Administration down in the States gives a pregnancy category rating to each of the medications, and it's usually based on what research has been done and that type of thing. None of the medications, disease-modifying therapies, have research on humans, basically. We don't do research on pregnant women. It wouldn't be ethical. So none of them are really considered safe, and so you definitely should be stopping them before you decide to have a baby. And again, like I mentioned before, have a plan for going back on afterwards. The other things that come up at our clinic a lot now, which is kind of new to MS, is we actually talk about fertility a lot more. And that's mostly because of the disease-modifying therapies. Also, sometimes we use things like chemotherapy drugs in patients who have very aggressive disease, and that forces a body into menopause. And so sometimes sperm banking or egg harvesting, things like that go on. So we actually deal with fertility issues a fair bit now. Infertility, like I mentioned before, MS does not cause infertility. The one thing I wanted to mention though, because it is more common to go through things like IVF and in vitro now, is that there are some small studies looking at the impact of that on MS. And they do indicate that there is a chance of an increased risk of relapse following a cycle where the IVF didn't lead to pregnancy. And that's not too surprising because it kind of flows in with what we know about pregnancy in the postpartum period as well. So we weren't too surprised about this result, but just something to be aware of. So you just know. We get asked all the time about the risk of MS for my child. It's very common. MS is not hereditary, but certainly we know there is a genetic link, as everybody in here probably knows. But there's other factors involved too in terms of developing MS. So the risk is low. So a person living in Calgary with no family history of MS have about a 2 to 3% chance of actually getting MS here in Calgary. If you have one parent that has MS, that goes up to about 4 to 5%. So just slightly increased, still considered very low, still 95 to 96% chance of not getting MS. Taking vitamin D during pregnancy, we highly recommend that. Having said that, there's no research to say anywhere how much vitamin D you should take during pregnancy. Our general school of thought is that you should maintain your 4,000 international units to have a stabilizing effect on your immune system, as well as hopefully a stabilizing effect on that baby's immune system, because that baby will need vitamin D as well. We do also often recommend that perhaps at some point during your pregnancy, your family doc could check your vitamin D level. We like, I don't know if everyone's familiar with the normal levels, but we like your level to be about 100 or above. So is what we would kind of like to target, and if we see levels that are less than that, usually we would increase your vitamin D. So certainly talk to your family about that, family doctor about that. Some family docs are more comfortable with talking about vitamin D than others, and but we would certainly still recommend the 4,000. So now you've actually gotten pregnant now. And so in terms of research about pregnancy, there's a lot of studies looking at outcomes in terms of what's happened when women with MS have gotten pregnant. And really we know a lot of studies indicate there's no differences in terms of the age of the baby or the birth weight of the baby. There's a couple very recent studies that kind of come out over the last year indicating that sometimes people with, women with MS will have a slightly lower birth weight baby than non-MS moms. But that needs to be researched more. We don't know that that's for sure yet because it was small studies, but certainly it's kind of a little bit of an interesting find.
Is that full term?
Pardon?
Full term?
Yes, full term, yeah. Age of MS at onset and disease duration seem to have no bearing on the outcomes of pregnancy, so you're able to have a baby at any point you were diagnosed, and that didn't make a difference. And in terms of the rate of C-section or vaginal deliveries, it was the same between MS and non-MS moms as well. So there was no differences there where women with MS didn't need C-sections or anything like that. They were able to go through and have a normal pregnancy. Pregnancy itself seems to have a very stabilizing effect on the immune system. It would be nice if we could be pregnant all the time, actually. But unfortunately, we can't mimic that yet. Relapses fall about 66% during pregnancy. And if you think about it, if you know anything about the disease-modifying therapies, it's probably better than any medication we have out there to treat the disease. We do know they decrease as the pregnancy proceeds. So in the third trimester, it's almost unheard of to have a relapse. And first trimester, you're still maybe at prone, although the rate will still begin to fall. The other thing to consider, we usually don't treat relapses with steroids or prednisone, but sometimes we do if someone's having a particularly severe relapse. And the important thing to consider too, if you are pregnant, would be very cautious about using steroids in pregnancy at all, but particularly during that first trimester, because it can cause things like cleft palate. Other symptoms that can be affected, certainly fatigue. I've heard actually both sides of the stories where if a woman has MS and then they get pregnant, certainly fatigue is part of it, but a lot of women will actually tell me that their fatigue improves during pregnancy. They have all this extra energy and that type of thing. So I really heard both sides of the coin in terms of that. Balance is important though. As that baby grows, your balance will be affected. So if balance is an issue for you beforehand, maybe you will need to see a physiotherapist or use a cane during that pregnancy just to prevent yourself from having falls and that type of thing. Back pain certainly is common as that baby grows. So things like massage can help, stretching, exercise, all those types of things can help when you're pregnant as well. And bladder and bowel problems, which are common in MS, obviously, are very common during pregnancy as well. You do have, if you are prone to urinary tract infections, that can increase your chance of preterm labor with the baby, so you'd want to be aware of that and have a lot of times family docs will check your urine once a month or that type of thing to make sure it's clear. And if you are using intercas and self-cathing to manage your bladder, you may need to increase the frequency of that as the baby grows and more pressure is put on your bladder. Pregnancy tips, I'm not going to go through all the details of these because they're really just wellness tips. The stuff that we went through at the beginning of the talk is really the same for MS as well as pregnancy. Yes?
I have a question because I don't quite understand why you have to take so much vitamin D. Like, what are I just don't understand. I mean, they're promoting it more nowadays than they were.
They are, yeah.
So what are the benefits of taking vitamin D?
We feel that, we feel there's a lot of benefits, but basically the gist of it is that it has a stabilizing effect on the immune system. She asked about vitamin D and why we recommend it. We do know that when people take it, they tend to, you know, hopefully, we hope they have less relapses. There's research looking into that right now, a little bit manage their symptoms. Certainly it helps people just keep that immune system on a nice even keel so it can't fire off as often and attack that myelin in your brain and spinal cord. So we do highly recommend it. The reason we recommend the amount that we recommend is based on research that we've done. So we've over the years, and this is over the last 10 or 15 years, we've done levels where we've recommended 1,000, 2,000, 3,000. And what we find is if people take 4,000, the majority of people, that will be enough to keep a normal level in your blood system.
So just one more question about vitamin D.
Sure.
You're supposed to take it with calcium?
No.
You don't have to?
You don't have to take it with calcium, no. Yeah, there's new research coming out asking about calcium, saying maybe women don't need to take as much calcium as they originally thought. So I would say talk to your family doc about the calcium level, but we don't recommend calcium unless you're taking steroids that would interfere with that or something. For the most part, it's vitamin D. There is a wonderful website out there for anyone who is pregnant or thinking of becoming pregnant. It's called Mums and MS, and Mums is M-U-M-S. That's not a typo. It's a website out of the UK, and it's excellent. I'd highly recommend it to anyone who wants further information on that or thinking of getting pregnant. In terms of preparing for the baby, again, open communication. Having a birth plan is really important whether you have MS or not. But being open and flexible with that birth plan, knowing that if you have things like fatigue or some muscle weakness or spasticity, that sometimes can affect your ability to push, and so you may need to have a forceps delivery or something like that. So just be open and flexible when you go into that birth plan with your doc, and talk to your family doc about that ahead of time, or whoever's delivering the baby. Epidurals we get asked all the time, including by anesthetists. Whether if you have MS you can have an epidural, and absolutely you can. There's no more risk to you than there would be to someone who doesn't have MS. And again, having a plan in place to resume your disease-modifying therapy after.
How long do they say after you have your baby should you be back on disease-modifying?
That's very variable and very personal, so it depends on a lot of things. It depends on what you want to, how long you want to plan to breastfeed your baby for, as well as, you know, really talk to your neurologist or nurse at the clinic about it, because if your disease is very active before, then you probably want to get on maybe a little bit quicker. Whereas if your relapse rate was pretty good before, then, you know, maybe you have a little bit more time, a little bit more flexibility after in that postpartum period. Preparing for the baby, I won't go into all details for the sake of time, because I know we're going to run short of time here soon. But the main thing I wanted to point out is think of plan with the baby room and where things are going to go. If you have everything you need to change the baby's diapers up in the baby's room, but you spend the bulk of your day downstairs, then by all means you'd want to change that or rearrange that around so you're not using all that extra energy just to run up and down the stairs to find everything you know for that baby. Breastfeeding and bottle feeding, that's another decision to make for sure. Certainly the Canadian Pediatric Association recommends breastfeeding for the first 6 months of a baby's life, but formula works as well, so you kind of have to make, you know, a decision based on that in terms of what you want to do. If you do choose to breastfeed, then having a plan in place in terms of nighttime feedings, and you need to pump your milk to allow for that to happen so you can get the rest that you need as well.
I think we're really close for time, aren't we, Carol?
Yeah.
So I don't know. Sorry, how many? 5 minutes? Okay, so some important points postpartum is that women who have more relapses prior to pregnancy are at a more risk for developing postpartum relapses. And the risk of a relapse doubles in the first 3 months, and then it is a little less in the next 3, and then it goes back to its pre-pregnancy rate. And an important part is that you won't become more disabled because you've gone through pregnancy, even if you've had a relapse. So I guess quickly, postpartum can be challenging for any of us new moms out there. And again, it's just about having adequate support in place, trying to get adequate rest, which is huge. Calling the MS clinic if you think you're having a relapse so that they can start the process. Again, a relapse is a constant symptom that lasts 48 hours or longer. And being aware of your mood, that's huge again. So it's easy just to kind of struggle through. You might be close to postpartum blues or depression, but there are resources available. Motherhood, well, you know, what do you say about that? It's just like humor, go with the flow, and things are going to happen. But again, open communication with your partner, trying to connect with other resources, with other moms. Menopause typically occurs around the age 50. It's defined as no period for 1 year. There's no evidence that it affects relapse rate or disease progression. And the biggest question kind of from women is, well, what are my MS symptoms? What are my menopause symptoms? Well, they're very closely related, and I think instead of worrying about that, it's more about finding strategies to help with those symptoms. So again, we push wellness strategies, looking for different management for fatigue. There's great resources available. A very popular one is a book by Christine Northrup called The Wisdom of Menopause. A little bit about osteoporosis. I think all of us have a pretty good understanding. Being female is a risk factor in itself. And then there are many risk factors, as you can see there. Also lack of exercises. We kind of think they're related to MS, more connected to MS. Lack of exercise because of an increased disability. Low vitamin D levels, we see that relationship with MS. Medications, especially steroids, as they deplete our calcium. At least 1 in 3 women will have a fracture related to osteoporosis. So that's pretty significant. So again, when you think of preventing osteoporosis, that's focusing on the wellness strategies. Eating a healthy diet, getting foods that are high in calcium, exercising, taking your vitamin D, and also if you need calcium supplements, discussing that with your family doctor.
That's it, guys. Sorry we had to rush a bit at the end to kind of get it in, but you have the information in our slides there. And again, don't hesitate to call or email either Janice or I about any of these issues at all, okay? We have some references listed there as well. And some great online websites that really talk about any of these issues that we talked about today. You can find information on them at these websites and stuff as well, okay? And thank you very much for your attention. And yeah, we'll take any questions you have, and I think you have a break after too, so Janice and I will hang around as well. So if you have questions that we can't get covered here, we can answer them for you. Sure.
I just have a quick question about menopause. How do you handle the hot flash? It sucks the energy out of you, right?
Yeah.
I mean, it's a multi-one.
Yeah. I don't think there's an easy answer for that. I think it's something we all struggle with. And just, you know, you can try things like cooling things, you know, windows, cooling if you're outside. The same types of things you use to manage heat and things in the summer, you can use for trying flashes and things like that as well. If they get incredibly intense, I mean, talk to your family doctor about it as well. Sometimes, you know, they can look at your different hormone levels and see if anything can be done to help that. But there's no quick fix for that for sure, unfortunately. Yes.
That's great.
I just want to mention that I am calcium for osteoporosis. If I did from my own family doctor, they say it doesn't work for magnesium.
Okay.
So that's why they combine.
Calcium and magnesium. Thank you for that. Yes.
You mentioned earlier the OPTIMUS program. What is that?
The OPTIMUS program is our it's an outpatient, program that specializes in MS. Gee, I work there. I got it. It's a It's a rehabilitation program. It includes an occupational therapist, a physiotherapist, a social worker, psychologist, and I'm the nurse in the program. And you can be referred to that program through the MS clinic. And it is an outpatient program. So you go through, you deal with your goals and concerns, and then we discharge you, but you can be re-referred at any time. Does that answer your question?
Yeah.
Okay. I think that's all the time we have for questions, but we'll hang around and feel free to come up and ask us questions.
So I'd like to thank Sharon and Peters and Janice White for their presentation, and something I really appreciate when I've been in the audience of Janice's presentations in the past is their openness and their level of comfort in talking about issues that are very personal and are often very difficult for us to talk about with other people. So I really, really appreciated that from the both of you today. So I'd also like to thank